Wakenya wapendwa, today I want to extend my appreciation to all of you who have stood with us and cooperated with the government in the last 3 months. I know very well indeed that it has not been easy. People have been infected, and majority of families, if not all, have been affected in some way or another. Businesses have been lost, and the lives of our school children greatly interfered with, and the economy of our country turned upside down. These have been difficult times indeed. This disease have overstretched the limits of our resilience as a country. However, it has not managed to break our resilience. It has not managed to break the cord and unity that binds us as a nation. I am truly convinced that in the fullness of time, we shall overcome this virus and even come out much stronger than we were before. In every testing time, something always good comes out of it. There is a silver lining, and in the fullness of time, we will see what the silver lining in this pandemic might be. We are not yet out of the woods. Indeed, it looks like we are getting more and more into the woods. The fight against disease has proven that it is a marathon rather than a sprint. As you are aware, and from our daily briefings, we have informed you that the disease is firmly rooted now within our communities. In fact, the level of spread in our villages and our estates and in our homes has become clearer from our targeted testing that was rolled out a couple of weeks ago. This means that we cannot afford to relent in this fight if we must safeguard the lives of our people. Fellow Kenyans, today we continue to combat the COVID-19 pandemic. We celebrate our partnership with Gavi. Gavi, the Global Vaccine Alliance, was founded in the year 2001, bringing together public and private sectors globally to improve access to new vaccines for children in developing countries. To date, Gavi has supported Kenya with over shillings 50 billion grant aid in the form of vaccines and 6 billion in direct cash support. The success of immunization facilitation by these assistance have led to tremendous improvement in child survival rates in our country, keeping the promise of a prosperous and healthy nation as we safeguard our children. We need to keep our children safe from killer diseases. His Excellency President Uhuru Kenyatta in 2019 took up the role of Gavi champion in support of Gavi replenishment. It is due to his commitment to immunization and improving the lives of children and his leadership in the global movement of universal health coverage that he is now championing Gavi replenishment. This afternoon, from 3 p.m., His Excellency the President will join key world leaders in the Gavi Global Summit, Vaccine Summit 2020, hosted by the Prime Minister of the United Kingdom of Great Britain, the Right Honorable Boris Johnson. His Excellency will seek to inspire greater leadership and resource allocation towards ensuring a successful replenishment of Gavi's program for 2020 to 2025, with at least a desired contribution of $7.4 billion to immunize an additional 300 million children in developing countries. Further, he will engage on the importance of accelerating local manufacturing of vaccines and access to a future COVID-19 vaccine. lessons out of the COVID-19 pandemic have taught us the need for self-reliance, especially in the manufacturing of goods and services. And this, ladies and gentlemen, is achievable. Turning to another subject altogether, in our efforts to deal with COVID-19 pandemic, the government has disbursed a conditional grant of 5 billion shillings to all 47 counties. This is aimed at bolstering the level of readiness in our health facilities, specifically for COVID-19. This money is a conditional grant divided amongst the counties in accordance with the formulas designed for them and with agreement from the Council of Governors. The reason is that it is now up to the county governments to utilize these funds to safeguard the lives of our people by ensuring that our local health facilities are well equipped and our healthcare workers are adequately catered for. If our counties are fully prepared and have the necessary infrastructure in place, then we shall have nothing to worry about. However, we all know what happens when the reverse takes place. I would like to reiterate here that this 5 billion is a substantial amount of money. Now, this is not to replace what the government, what the health ministry has already been doing for the counties. We have been supplying PPEs, we have been supplying ventilators, we have been giving additional support to the counties, and we will continue to do so. But we felt it is important for counties to take responsibility in terms of the preparedness, particularly issues to do with the isolation facilities, issues to do with quarantine facilities, issues to do with monitoring with health workers, community health workers, training them so that they are able to take care of COVID patients even in their own homes. So what we are saying is that this is to establish a deeper, the money is there to establish a deeper relationship, a deeper understanding, a deeper association with us as we continue to fight against this pandemic. With the fight against the virus continuing, we have realized that over 80% of our patients in hospitals are asymptomatic, and therefore baby can and may be managed from home. If this is implemented, it would free our health facilities from congestion, because we are reaching, for example, in Nairobi, at a time when Bagathi, both Bagathi and KU, are already getting to full status. The Ministry of Health is in the process of actualizing, and indeed we have already completed the process of actualizing home and community-based care protocols for rollout and to be implemented countrywide. What this means is that a lot of people who are in isolation facilities may be released to be taken care of at their homes, provided two things happen. A, it is in accordance with new World Health Organization protocols that we are still looking at and trying to customize and domesticate to our situation. Number two, it has to do with the facilities that families may have, and where no such, and where families are not able to either self-quarantine or self-isolate, the government will still assist in the process. But I would like to make it clear that a time is coming when we cannot continue as usual, that we have to change tax. Taking care of 500 people is not the same as taking care of 5,000 people. And obviously 5,000 people is a completely different ballgame from 50,000 people. We have learned over the last 3 months or so, we have been in school learning how to manage this disease, understanding this disease, going with the protocols that we were learning from other people. But now the time has come when we must also begin to implement our own systems in our own place, depending on our own environment, and because it is the only way that we can be able to cope with what we are expecting in the future. So the Ministry of Health is going to be issuing these protocols, and when they do, the most important thing will be how our citizens, how our warriors in the fight against this virus, and those warriors are our own people. It is you and I. We are the warriors against this disease. Therefore, when people come home and they are supposed to be in isolation facilities, it will call for a degree of discipline that honestly we must stick to. Because if we don't stick to that degree, we are going to have a problem. So I'm appealing to all Kenyans, as soon as this protocol is out, that when we see people coming home, we will understand two things. There are no danger to us, first and foremost. There will be no danger to us, and therefore, there is no need for stigmatization. It is not necessary. You will be safe, but the people concerned will have to take care, and the families, you have to take care of them, so that they do not, because they do not need hospitalization. On that same note, my attention has once again been drawn to cross-border truck drivers. In the last few weeks, we have witnessed a large number of truck drivers at border points testing positive. Let me make it clear that all drivers take a COVID-19 test at least 48 hours before embarking on their journey and acquire a COVID-19 free certificate. We have, however, noted that a majority of the truck drivers are commencing their journey to the borders without this valid document, expecting to be tested at the border points. This has resulted to unnecessary congestion and delays that have been witnessed at our border points. This is purely indiscipline, which is unacceptable and will not be tolerated. I'm urging our law enforcement officers to take appropriate action against each such driver flaunting these measures. Na wajua tunaambia mambo mengi tukiwa hapa, habari hawa madereva. Kule port KPA, wale ambao wanaingia huko wakiwa na magari, kwa sababu tumetoa amri ya kwamba hakuna driver ambaye anaweza patiwa mzigo na gari akiwa yeye hana COVID-19 certificate. Lakini wale wanafikiri ni wajeuri sana, wanapatiana gari zao, wanaingia port na driver moja ambaye ana certificate. Anaingia ndani ya port, anatoa mzigo, akitoa mzigo kufika hapo nje, anapatia driver mwingine ambaye hajafanywa test. Huyo sasa ndio anatoka kutoka hapo, anaenda mpaka Busia. Na mimi nashangaa sana kwa sababu najiuliza, kutoka Mombasa jameni, na mimi nikitembea mimi mwenyewe nasimamishwa roadblock mengi. Huyu mtu ni kusema amepitia njia ingine ambayo haina roadblock, ama ni kusema alipitaje roadblock na anaenda mpaka Busia. Mimi sitaki kusema ati kuna kitu ama mimi sioni, lakini wewe mwenyewe jiulize. Hata ukiwa wewe sio mwelevu sana, unafikiri alipita namna gani kutoka Mombasa mpaka akafika Busia? Alifikaje huko? Na wale askari walikuwa hiyo barabara, ni hadithi gani wanaweza kutupatia vile huyo mtu alipita hiyo barabara yote? Kwa hivyo kuendelea mbele ni lazima tuanze kuuliza, kama mtu alipita saa fulani na tunajua ni askari gani walikuwa barabarani saa hiyo wakati yeye alipita. Ni lazima tushughulike na hiyo maneno na kujiuliza, ulikuwa umelala hukuuliza kama huyu ana hii COVID certificate? Na kama hukuuliza, kwa nini hukuuliza? Yaani kuna mazungumzo hapo, si wewe unaona hivyo? Kwa sababu wengine wanafika huko boda wana certificate zao. Some people are very law adhering. Wengine wanafuata sheria. Wanachukua, wanaenda Mombasa, wanaenda 48 hours before, anapatiwa certificate yake, anaenda mpaka Busia, mpaka Namanga. Akifika hapo anasimamishwa hapo kwa siku mbili, kwa sababu wale ambao hawana ndio wamepanga mizigo huko mbele, wamepanga magari mbele yake, wana double park, yeye hawezi kupita. Askari wanaenda wanamwambia siwende, wewe una certificate. Nauliza sasa mimi naedaji? Hapa mbele yangu ni magari imejaa, na wale wako hapa mbele hawana certificate. Kwa hivyo hata wewe ukiangalia unaweza ona hii ni mambo ya ile tunaita indiscipline. Hii ndio shida ambayo iko kwa boda. Iko watu wengi sana ambao wanafuata sheria hapo, madereva wazuri, na unajua hata ukikaa hapo siku ngapi huwezi kupita hiyo boda kwenda Uganda bila hiyo certificate. Vile vile tuna shida pande ya Tanzania, na tunasema hivyo hivyo, lakini upande wa Tanzania mambo ni ingine. Hiyo sasa ni hadithi zingine, ni stories zingine hizo, ambao tunasema ukija lazima utoe certificate, na ukiwa huna certificate huwezi kuingia Kenya, kama vile tu Mkenya haiwezi kuingia Uganda ama aingie Tanzania bila certificate. Lakini hiyo certificate lazima iwe ni certificate ya maana. Lazima it must be an authentic certificate. Huwezi kuingia kiosk ama clinic unapatiwa karatasi ambayo inasema uko COVID free na anafanya kastamp, anafanya kastamp Dogomano clinic kap analete kwa boda. Hiyo jameni, hiyo haiwezekani. Ni lazima tusikizane, lazima tupeane heshima. Uje na certificate ambayo it is certified from a WHO recognized lab. It is the only way that you can be certified. So because of these things that are going on, I really want to ask for cooperation between our drivers, particularly truck drivers. Tafadhalini, if you don't want us to have this problem you're having in Busia, please, tafadhalini, fuateni sheria. I had rather have people demonstrating in Mombasa because they can't be tested because of shortage of testing aids, testing kits, than have people in line up in the border posts. Pertaining to our COVID-19 situation today, 124 people have tested positive from 2,640 samples in the last 24 hours. Therefore, the total number of positive cases in Kenya now stands at 2,340, while the total number of samples tested so far is 87,698. The positive cases include 119 Kenyans, 2 Somalis, 2 Tanzanians, and 1 Eritrean national. These figures do not include the number of foreigners we have tested at the border and turned them back to their countries. Mombasa had the highest figures today, standing at 40, while Nairobi at 38, and now Busia at 26. You can see what I'm talking about. All these 26 people you are seeing here from Busia are essentially truck drivers who are being tested at that spot. Now, which then bears and brings a big problem for the Busia government, because it means you have to start quarantining, isolating people who are not necessarily from the Busia County. Kajiado, the same thing, with 6 of them again, and so on and so forth. Now, today, Elgeyo Marakwet becomes the latest county to report a COVID-19 case, bringing now the total number of counties that have been affected to 36 out of the 47. In Mombasa, the 40 cases that were there, out of the 40 cases, 14 of them are from Mvita. Again, the same thing. We have 14 from Kisauni and 11 from Changamwe. The same trend again in the same areas. In Nairobi, we have 38 cases from Kibera, 25 from Kamukunji, and 25 and the cases from Kibera, a lot of them are in the quarantine facilities. 25 from Kamukunji as well. I would also like to add that in terms of gender, again, 100 are male and 24 are female. We still have to come down and find out why over 70% of the infections are still in male and are still the male gender. In Garissa, the 2 cases that we got came from Dadaab, and while in Muranga, we have 1 case which is in Kiharu. Now, when you start hearing of these rural areas, then you know that we really do have community infections. We are also happy today that we have discharged 39 patients from various health facilities, bringing our total number of recoveries to 592. We want to pray that we get more of those, and we want to completely support and thank our healthcare workers for the work that they continue to do to see that as many of our people as possible recover. Unfortunately, we have also today lost 4 patients to the disease, bringing the number of fatalities to 78. Our sincere condolences go to the families of those departed. Finally, I want to thank Kenyans who have taken the containment measures seriously and followed them strictly. I appeal to those who haven't joined us in this work to do so. I thank you.
My name is Sam Gituku from Citizen TV. 2 questions, and first...
Sam, I can't hear you.
Okay. Right, so 2 questions. First, the latest reports before today, we got the figure of about 261 missing contacts, or people that you're describing as difficult cases. Would you know what the progress is in tracing these people, and do you know where they are distributed based on the location of the sample collection? And secondly, how do you account for all the active cases that we now have? Because the last time we heard of this description, there are those patients that are being treated from home. So how do you account for all these people? If you could respond to those.
Nancy Okware kutoka KBC. Swali langu la kwanza linawiana na lilouliza Sam Gituku kuhusiana na hao wagonjwa ambao walitoweka baada ya kupeana habari zisizo za kweli, hususan kuhusu nambari za simu. Je, kufikia sasa hivi bado mnashuhudia hilo tatizo la Wakenya kutoa nambari zisizo sawa, ama mmeweka mikakati gani ili kuhakikisha mambo yako shwari? Na mwisho kabisa, huo mfumo uliosema ya kwamba mnataka kuzindua wagonjwa wawe wanatibiwa kutoka pale nyumbani, je, mnaona kwamba utaweza kufanya kazi humu nchini kizingatiwa kwamba wakati wa kuweka watu quarantine pale mwanzo ilikuwa tatizo, wengine walikuwa wakitoroka?
Lalian TV. Just two from me. In terms of the systemic reopening, we've had leaders giving various opinions of how it should be implemented. We've had also the Kotu SG saying that, Kenyans are tired of, staying at home. They need to go out and get food on the table. So who's going to be the authority in terms of the reopening that is much anticipated? Another question would be, you talked about Afia House restructuring, and there are reports that, the affected departments have simply refused or declined.
Sorry, sir.
Oh, in terms of the Afia House restructuring, yeah, you'd given a memo trying to restructure the Afia House, the Ministry of Health, and there are reports that some departments are reluctant or simply they have declined to move. What is your next course of action? Thank you.
Thank you.
What is the status at the industrial area remand prison? There are reports that 38 convicted inmates who serve food in 3 blocks, including block B and D, have tested positive. They also say they don't have masks and they are being locked in the blocks without chances to wash their hands and such actions that you are propagating for.
Rita, is that from the prisoners themselves or from somebody else?
An inmate we spoke to this morning.
First and foremost, I am not aware that indeed that is the case. In fact, yesterday, when we had a session with the PS, she was very clear that there was no issue and everything is being taken care of. It would be irresponsible for anybody to keep prisoners who have tested positive without the necessary care. And by the way, that management is done by both the prison authorities as well as the Ministry of Health officials. So we treat them just like any other patients would be. Seth, you talked about the reopening and that somebody is talking about Kenyans being tired of staying at home. Which ones are those? Because from what I have seen, Seth, I would like you to point to me, not the people who are staying at home. Because then what we are saying, in effect, Seth, is that we are aware that people have not really been staying at home. Let's start from there. We are not blind to what has been going on. And the reason why we have continued to open up in some of the areas like the restaurants and so on is realization that some of these areas can be opened. And nobody has spoken about reopening. Let's just take this in our pace. Nobody has spoken about reopening, not in the form that we might understand. This is something that is still being looked at. It is something that our experts are still looking at the modeling to decide and make a decision to see what we will advise the president on this matter. As we speak, there's a meeting going on. Yesterday we spent the whole day at the command center discussing the same issues. We discussed, we had meetings here in the afternoon with experts, modeling and disease experts from University of Nairobi, JUCAT. They were here yesterday. I think you saw them during the presser. All these things are consultations so that we can arrive at a decision that best suits Kenyans. So speculation about whether or not we are going to take this action or the other action will only become clear when that decision has been taken. As far as the home care aspect is concerned, and the question is from Nancy was, why do we think, if I get it right, why do we think that if they did not follow the quarantine rules before, that now they are going to do it? I think 3 months ago is a long time in the space of this disease. 3 months is a long time. And when we started, people probably thought there is no such thing. There is no such disease. We still hadn't gone through the motions that we have gone through, educating Kenyans every day, telling them what they must do every day, and we would imagine, I would like to imagine, that during that period, our behavior has begun to change. We have begun to take seriously what we are talking about. We now know that if somebody is not quarantining themselves, they will affect their children, and they will affect their friends. And I think that it has come to the point where that responsibility must now be given to citizens so that we can live up to the creed that we have continued to preach, that we are partners in this fight. That is the point. That is the point at which we are at. Now is the time to prove to each other that is a true partnership and that we can take care of each other. There is no debate about whether or not the disease is here. There is no debate about whether or not a person who is infected can infect you. There is no debate about whether persons who are quarantined are a danger because they can infect the other person. So all that has come to pass. And I think that to continue on as if we are not expecting Kenyans to learn anything is honestly an abuse to citizens. So I think citizens now must do the right thing. Protect each other, protect their families, and protect their friends. This is what we have got to do. And I think the time is right for us to do that. On the issue of the tracing, it is tied up to the first question, to the second question. Because again, when you put your phone down, and then we even had somebody who went with the phone, and because they know we are tracing them, leaves the phone somewhere, travels from Kawangware, goes all the way towards Thika, comes back from Thika. The friends are all telling us, everybody is calling us and telling us this is where this guy is, this is where the person is. At some point, when we get to the point where we know that some people are running away and they are out there, there is nothing to stop the Ministry of Health from publishing photographs in the newspaper and telling them these persons have run away from a quarantine facility, and if you see them, please call the police or call us, because they are a danger to the society. Or people who are positive and running away. We had 6 of them do that in Turkana yesterday. Persons who are in a facility. Fortunately, we have been able to track them down. But you can see the irresponsibility that I'm talking about. I think Kenyans must not agree that this be done. If you see a stranger in your vicinity, if you know that a person is supposed to be in a quarantine facility, if you know that a person is in an isolation facility, then the onus falls on us to ensure that the right thing is done. And again, on the same thing, Sam, about the missing contacts. There is nothing like missing contacts. There are missing persons, but there is no missing contact. Because we have proven over and over again, we can and we do track people down. But the question is, why are you waiting for us to track you down? Why? Why? What is it I'm missing? What is it you are not getting? About a person who is unwell and runs away, there is no charge in a quarantine facility. On the contrary, you are being fed. Yet you run away. This is why we are saying, instead of putting people in a situation where they are running away, why not just let them go home? All right? So that you run away from your own home. Because, I mean, why put you in a facility to run away? We were putting you there to protect your family. So if you want to go and infect your family, let your family now also take responsibility of saying you're not coming back to our house. And this is where we are going to get to, and it's going to happen. Mark my words, it's going to happen. On the issue of Afya House restructure, every employee whether you are employed by the government, whether you are employed by a private sector, a parastatal, has got a contract of employment. And that contract of employment spells out very carefully, that under these conditions, this is where you will work. Most contracts will spell out, you can be transferred here or there. You will retire at the age of 60. Upon reaching your age of 60, this is what you will do, or this is what is supposed to happen. And I can assure you, there is nothing this ministry has done that is outside of the contract of employment. There is nothing that this ministry can do that will be outside of a contract of employment. I have been around for a long time, Seth, and I have honestly never been in any institution where people refuse to be transferred. I have never seen it anywhere else. I don't even believe that there is any other ministry in this republic that encounters situations where individuals sitting in very interesting positions refuse to move from that position until you physically send somebody to assist them through that gate. It's a very interesting situation. You know, one would imagine that if you are going to hit the age of 60, you are looking forward, you know, to retirement, and you go home. This is the only place where I know people get to 60, and instead of wanting to go home, you know, if we need you, if you are 60, and we need your services, we will contact you and ask you to please stay on for another year or two or whatever period, because your expertise is needed in our institutions. And we do have people in this ministry who we have requested that they stay on because we need their services. But I think the person who can determine whether your services are required or not is your employer. You cannot yourself go and tell your employer that under no circumstances am I retiring. I mean, retirement has come. Anyways, yes. So the issue of restructure is an ongoing process. Reforms happen in all our sectors, in all the sectors of our economy, in public and private sector. And we will continue to restructure. And I can assure you, there shall be no resistance that can stop the restructure of this ministry. If we do not do that, then Kenyans will judge us very harshly when they do not get health services at their clinics and their hospitals. So it is not a question of whether we will restructure or not. It is an ongoing process, and it shall continue. It will not stop. Two more questions.
My name is Felix from Football News. I just want to ask you if it concerns you. Does it concern you that the law enforcement officers are taking the lives of healthy Kenyans? And question number two, you say that...
Sorry? I didn't hear that.
All right. All right.
Sorry, repeat that, please.
Okay. Does it concern you that law enforcement officers are taking the lives of healthy Kenyans? And then question number two, you mentioned about policemen not being upbeat at probably the roadblocks and stuff. What are you willing to do about it?
Last one.
Waziri, naitwa Boni kutoka Aero TV. Mimi hapa nimejawa na hofu kwa sababu waziri, najua kwa muda sasa umekuwa ukitengamana na watu wengi sana. Ningependa kujua kama umechukua hatua ya kwenda kujifikisha kwa kituo cha afya kuangaliwa hali yako ya afya, kwa sababu sikuombei na ugonjwa, lakini
asante sana ndugu yangu. Nimeshukuru kwa sababu mimi nadhania utaendelea kuniombea na mimi pia nitakuombea, lakini hebu nikueleze hapa ni lazima tunaendelea kupimwa mara kadhaa, kwa sababu kama wewe kama ulivyosema, tunatembea sana, tunaenda mahospitali, tunaenda pengine iko na wagonjwa, ndio tunatumia mask, vile vile tunapimwa. Wewe umepimwa? Hata mimi nimepimwa, sio mara moja, mara kadhaa. Lakini ile kitu mzuri ni kwamba badala ya kugoja kupimwa, wewe jikinge sana na uweke Mungu mbele. Uweke Mungu mbele na ujikinge. Hiyo ndio kitu ya maana. Am I concerned that law enforcement officers are taking people's lives? I'm not aware. Who are those who are taking people's lives? Because if they are, then obviously the law must follow its course. And when you say taking people's lives, I don't know whether you mean by killing them. I don't know whether you mean by allowing infected people to infuse themselves with them. I don't know. But in any event, notwithstanding what the meaning of the question was, is that the law must always and at all times be followed. Otherwise, if we didn't follow the law, then it would be anarchy. And anarchy leads to disorder, and disorder benefits nobody. So, yes, I would like to see a system where on the roadblocks, I would like to hear that as many people as possible have been stopped, and are parked on the side until they go and acquire the necessary documentation that they are supposed to. But as you know, and to be honest, let's not bury our heads into the ground like the proverbial ostrich. It is true that amongst even enforcement officers, we do have people, who are breaking the law. It is a fact. But we have, as a government, taken measures where this has been the case, just like we have taken measures against health officers who do not adhere to what we have said. So asanteni sana, thank you very much indeed. Sasa
positive but you cannot reach them. Where are they distributed? And secondly, the breakdown of the active cases that we have now so far. How many are in hospital? How many cannot be accounted for? How many have, if you can give us that breakdown.
Let me start by saying there is none that can't be accounted for. Then I pass it on to Dr. Amo to respond with the details.
Thank you, Waziri. In terms of, we can be able to account for everybody based on the cumulative numbers that we have had. And on the cumulative numbers, you look at the index test, the first test. And then out of that, of course, you minus the negatives, then you remain with the positive cases. Then the positive cases, you minus the deaths, the recoveries or the discharges. You minus those who are repatriated. And this difficult group of people who gave us the wrong contacts. And as Waziri has said, you are on track to be able to catch up with them. And we are making good progress. So in terms of accounting for all the people who are in the line list, we can, and we can be able to share that information with you. As we shared with you last week on Friday, of course, as the numbers increase, the figures change. But basically that is the permutation. That you have the positive cases, you minus the deaths, discharges, the repatriated people, those who are on self-isolation, either pregnant mothers who cannot be isolated in a facility, or mothers with very young children who cannot be isolated in a facility, based on a risk profiling that we have done. Then, and also those who came from outside the country, those who went for treatment. Even as of today, we get requests for people who went for treatment in India, for cancer, for serious surgery. When they are back, those are not people that you can put in the isolation facility. You do a risk profiling or a risk mapping, and based on that, together with their primary care physicians, they are best served at home in a home-based isolation facility. But beyond that, we are also exploring the possibility of community-based isolation. And Waziri, allow me just to highlight something about home-based care that you are going to launch very soon, probably by the end of this week or early next week. And this is a key intervention that is approved by the World Health Organization, and it is meant to decongest health facilities and prevent the healthcare systems from being overwhelmed. Remember, majority of our cases are asymptomatic. So it makes no business sense to be able to manage these people in a hospital facility. You can be able to manage them in a home-based isolation facility or a community-based isolation facility based on that risk mapping. And this has worked very well before. You remember during the early days of HIV, the pandemic, low middle-income countries were able to quite well work out on the intervention of home-based care with very, very good success. And also because we are going to carry out behavior change communication to the community so that we have their buy-in, we believe that we should all succeed together in this. Remember also, as a clinician, patients recover best at home because they are more familiar with the home environment rather than a hospital-based facility. Thank you.